I'm Jean Good. I'm a registered nurse and I work as a nurse navigator at Connect Care 3. Today I'm going to talk to you about diabetes and diabetes prevention. I bet most of you who are watching this know someone with diabetes. And that's not surprising because over 30 million people in the United States have diabetes, type 2 diabetes. 1 in 10 Americans have this. And 1 in 4 don't know they have it. You may be wondering, well, why wouldn't they know that they have it? Sometimes people don't see a primary care physician. They may have really mild symptoms, so they don't even know that they have it. It's predicted that by 2050, 1 in 3 Americans will be living with type 2 diabetes. In 1990, only 6 million were living with type 2 diabetes. In the United States, over 84 million people have something called prediabetes, and this is something that everything's determined by blood work and by glucose levels in your blood. And prediabetes is higher than normal sugar, but not enough to be considered a diagnosis of a diabetes. So 1 in 3 American adults have prediabetes, and once again, 9 out of 10 don't know they have it. Again, for the same reasons. They may not be seeing a primary care physician, they don't have symptoms. Diabetes is a disease in which the body is unable to properly use and store glucose. The body may not produce enough insulin, or it is unable to use insulin properly. So after you eat, your stomach converts the sugar into glucose and it gets released into your bloodstream. Eating foods high in sugar will cause more glucose to be released. In response to the glucose entering your bloodstream, your pancreas begins producing insulin. The insulin is to help get the glucose into the cells for energy. Once the insulin and glucose team up in the bloodstream, glucose can then enter the cells, providing your cells with energy. Insulin is the key needed for the process of getting glucose into the cell. So, poorly controlled diabetes can affect nearly all systems of the body. Diabetes can increase the risk of cardiovascular disease. This includes stroke, heart attack, and heart failure. It can cause vision loss and blindness. One of the symptoms, and we'll talk more about symptoms later, is blurry vision. It can cause gum disease that affects your overall health and wellness. It can cause kidney disease and kidney failure, leading to dialysis. So the blood vessels that have a lot of the sugar in them are leading to poor circulation, and it can lead to amputations. And there's also something called neuropathy that people with diabetes often have, and that is numbness and tingling in both their hands and their feet. So it's important to know your numbers, and these numbers are based on lab work. And there's 2 different types that are measured, and one is called a fasting blood sugar, and that's what is typically done. Your doctor may do a screening or something. You may participate with biometric screening at your place of work. And a normal reading for that is below 100. A pre-diabetes reading is 100 to 125, and diabetes is over 126. There's also a blood test called hemoglobin A1C, and this is the average of your blood glucose for the past 3 months. A normal reading is less than 5.7, pre-diabetes is 5.7 to 6.4, and diabetes is 6.5 and above. And your diagnosis would not be made typically on just one reading. Typically they'll do more than one. The next thing that's really important is to know your risk factors. So there are 2 different types of risk factors, and they are non-modifiable, meaning you can't change them, and modifiable risk factors, meaning you can change them. So if you're 45 years of age or older, you are at a greater risk to develop type 2 diabetes. If you have a family history of type 2 diabetes, and ethnicity also plays a role in risk factors. If you're African American, Latino, or a Pacific Islander, for example, you would have a higher risk for type 2 diabetes. Modifiable risks include activity level. So if you're active, that's a really good thing, but if you're not active, it's not too late to become active. If you're overweight, that can lead to a risk of type 2 diabetes. Women who have had a history of gestational diabetes when they're pregnant is also a risk. I'm going to talk about the staggering costs of diabetes. Someone who has diabetes has healthcare costs 2.3 times greater than someone without. Remember, we talked about diabetes affects all systems of your body, so you can understand why the cost would be greater. On average, a diagnosis of diabetes costs all Americans $327 billion a year. Today, 4,110 Americans will be diagnosed with diabetes. Don't let it be you. So excess sugar and eating excess sugar and having it floating around in your body can lead to something called metabolic syndrome. And that's where you have an elevated blood pressure, your blood sugar level is elevated, and you have unhealthy cholesterol levels and excess abdominal fat. Excess sugar also can contribute to inflammation, an increase in cardiovascular disease, and of course, type 2 diabetes. Excess sugar can also lead to cognition issues, both in adults and children. We all kind of know about children. There's talk about excess sugar leads to hyperactivity and inattention. The World Health Organization recommends restricting added sugar consumption to less than 10% of your daily calories. The American Heart Association takes it a step further and recommends less than 5% of your daily calories come from added sugar consumption. So for women, this is 6 teaspoons a day on average, and for men, it's 9 teaspoons a day. 200 years ago, Americans ate 2 pounds of sugar a year. In 1970, it was 123 pounds of sugar a year. And in today's world, it's about 152 pounds per year. That's 3 pounds a week and 42.5 teaspoons a day. Sugars are hiding in our foods, so it's really important to eat whole foods. Are you aware there are over 61 names for sugar? Some of those words are dextrose, rice syrup, barley malt, for example. So sugars hide in energy bars, salad dressings, and spaghetti sauce, to name a few. So just be aware and read your nutritional labels so that you know how much sugar you're taking in. You can avoid diabetes by being careful about what you're eating, exercising, and being healthy. Connect Care 3 can help you on this journey by offering Healthy Goals program, where you can work with a health coach who can help you develop an exercise program, and also with healthy eating goals and information. We also have a registered dietitian on staff. So thank you, and be healthy.